Hey Alpha Nurses, I'm Licensure from alphanursguide.com. This is 50 practice NCLEX questions. Without the way, let's get started.
During a vaginal examination, the nurse palpates fetal buttocks that are facing the left posterior and are 1 centimeter above the ischial spines. Which of the following is consistent with this assessment? 1. LOA -1 station. 2. LSP -1 station. 3. LMP +1 station. 4. LSA +1 station. The correct answer is 2. LSP -1 station. The LOA position refers to a fetus whose occiput is facing toward the mother's left anterior, and a presenting part at -1 station is 1 centimeter above the ischial spines. The LSP position is the correct answer. The fetal buttocks are facing toward the mother's left posterior, and buttocks at -1 station are 1 centimeter above the ischial spines. The LMP position refers to a fetus whose face is facing toward the mother's LP, and a presenting part at +1 is 1 centimeter below the ischial spines. The LSA position refers to a fetus whose buttocks are facing toward the mother's LA, and a presenting part at +1 station is 1 centimeter below the ischial spines. The nurse enters a laboring client's room. The client is complaining of intense back pain with each contraction. The nurse concludes that the fetus is likely in which of the following positions? 1. Mentum anterior. 2. Sacrum posterior. 3. Occiput posterior. 4. Scapula anterior. The correct answer is 3. Occiput posterior. A fetus in the mentum anterior position is unlikely to elicit severe back pain in the mother. A fetus in the sacral posterior position is unlikely to elicit severe back pain in the mother. When a fetus is in the occiput posterior position, mothers frequently complain of severe back pain. A fetus in the scapula anterior position is unlikely to elicit severe back pain in the mother. When performing Leopold maneuvers, the nurse notes that the fetus is in the left occiput anterior position. Which is the best position for the nurse to place a fetoscope to hear the fetal heartbeat? 1. Left upper quadrant. 2. Right upper quadrant. 3. Left lower quadrant. 4. Right lower quadrant. The correct answer is 3. Left lower quadrant. The left upper quadrant would be the appropriate place to place a fetoscope to hear the fetal heartbeat if the baby were in the left sacrum anterior position, not the left occiput anterior position. The right upper quadrant would be appropriate if the baby were in the right sacrum anterior position. The fetoscope should be placed in the left lower quadrant for a fetus positioned in the left occiput anterior position as described in the question. The right lower quadrant would be appropriate if the baby were in the right occiput anterior position. On examination of a full-term primipara, a labor nurse notes, active labor, right occiput anterior, 7 centimeters dilated, and +3 station. Which of the following should the nurse report to the healthcare provider? 1. Descent is progressing well. 2. Fetal head is not yet engaged. 3. Vaginal delivery is imminent. 4. External rotation is complete. The correct answer is 1. Descent is progressing well. The presenting part is 3 centimeters below the ischial spines. Descent is progressing well. The fetal head is well past engagement. Engagement is defined as 0 station. The woman, a primipara, is only 7 centimeters dilated. Delivery is likely to be many hours away. External rotation does not occur until after delivery of the fetal head. 1 hour ago, a multipara was examined with the following results: 8 centimeters, 50% effaced, and +1 station. She is now pushing with contractions, and the fetal head is seen at the vaginal introitus. The nurse concludes that the client is now 1. 9 centimeters dilated, 70% effaced, and +2 station. 2. 9 centimeters dilated, 80% effaced, and +3 station. 3. 10 centimeters dilated, 90% effaced, and +4 station. 4. 10 centimeters dilated, 100% effaced, and +5 station. The correct answer is 4. 10 centimeters dilated, 100% effaced, and +5 station. In option 1 and 2, this client is still in stage 1, which is when the cervix is not fully effaced or fully dilated, and the station is high. In option 3, although this client is fully dilated, the cervix is not fully effaced, and the baby has not descended far enough. In option 4, the cervix is fully dilated and fully effaced, and the baby is low enough to be seen through the vaginal introitus. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is caring for a nulliparous client who attended Lamaze childbirth education classes. Which of the following techniques should the nurse include in her plan of care? Select all that apply. 1. Hypnotic suggestion. 2. Rhythmic chanting. 3. Muscle relaxation. 4. Pelvic rocking. 5. Abdominal massage. The correct answers are 3. Muscle relaxation, 4. Pelvic rocking, and 5. Abdominal massage. Hypnotic suggestion is usually not included in childbirth education based on the Lamaze method. Rhythmic chanting is usually not included in childbirth education based on the Lamaze method. Muscle relaxation is an integral part of Lamaze childbirth education. Pelvic rocking is taught in Lamaze classes as a way of easing back pain during pregnancy and labor. Abdominal massage, called effleurage, is also an integral part of Lamaze childbirth education. The nurse reviews the record of a child who was just seen by a healthcare provider. The HCP has documented a diagnosis of suspected aortic stenosis. Which specific sign-symptom of aortic stenosis should the nurse anticipate? 1. Pallor. 2. Hyperactivity. 3. Exercise intolerance. 4. Gastrointestinal disturbances. The correct answer is 3. Exercise intolerance. The child with aortic stenosis shows signs of exercise intolerance, chest pain, and dizziness when standing for long periods. Pallor may be noted, but it is not specific to this type of disorder alone. Options 2 and 4 are not related to this disorder. The nurse has reinforced home care instructions to the mother of a child who is being discharged after cardiac surgery. Which statement by the mother indicates the need for further teaching? 1. A balance of rest and exercise is important. 2. I can apply lotion or powder to the incision if it is itchy. 3. Activities during which the child could fall need to be avoided for 2 to 4 weeks. 4. Large crowds of people need to be avoided for at least 2 weeks after this surgery. The correct answer is 2. I can apply lotion or powder to the incision if it is itchy. The mother should be instructed that lotions and powders should not be applied to the incision site because these items can affect the skin integrity and the healing process. Options 1, 3, and 4 are accurate instructions regarding home care after cardiac surgery. The nurse is told that a child with rheumatic fever will be arriving to the nursing unit for admission. Which question should the nurse ask the family to elicit information specific to the development of RF? 1. Has the child complained of back pain? 2. Has the child complained of headaches? 3. Has the child had any nausea or vomiting? 4. Did the child have a sore throat or a fever within the past 2 months? The correct answer is 4. Did the child have a sore throat or a fever within the past 2 months? Rheumatic fever characteristically presents 2 to 6 weeks after an untreated or partially treated Group A beta hemolytic streptococcal infection of the upper respiratory tract. Initially, the nurse determines if the child has had a sore throat or an unexplained fever within the past 2 months. Options 1, 2, and 3 are unrelated to RF. Acetyl salicylic acid is prescribed for a child with rheumatic fever. The nurse should question this prescription if the child had documented evidence of which condition? 1. Arthralgia. 2. Joint pain. 3. Facial edema. 4. A viral infection. The correct answer is 4. A viral infection. Anti-inflammatory agents, including aspirin, may be prescribed by the healthcare provider for the child with RF. Aspirin should not be given to a child who has chickenpox or other viral infections, such as influenza, because of the risk of Reyes syndrome. Options 1 and 2 are clinical manifestations of RF. Facial edema may be associated with the development of a cardiac complication. The nurse assists with admitting a child with a diagnosis of acute stage Kawasaki disease. When obtaining the child's medical history, which manifestation is likely to be noted? 1. Cracked lips. 2. A normal appearance. 3. Conjunctival hyperemia. 4. Desquamation of the skin. The correct answer is 3. Conjunctival hyperemia. During the acute stage of Kawasaki disease, the child presents with fever, conjunctival hyperemia, a red throat, swollen hands, a rash, and enlargement of the cervical lymph nodes. During the subacute stage, cracking lips and fissures, desquamation of the skin on the tips of the fingers and toes, joint pain, cardiac manifestations, and thrombocytosis occur. During the convalescent stage, the child appears normal, but signs of inflammation may be present. The nurse caring for an infant with congenital heart disease is monitoring the infant closely for signs of heart failure. The nurse should observe for which early sign of heart failure? 1. Pallor. 2. Cough. 3. Tachycardia. 4. Slow and shallow breathing. The correct answer is 3. Tachycardia. The early signs of rheumatic fever include tachycardia, tachypnea, profuse scalp sweating, fatigue, irritability, sudden weight gain, and respiratory distress. A cough may occur with HF as a result of mucosal swelling and irritation, but it is not an early sign. Pallor may be noted in the infant with heart failure, but it is also not an early sign. The nurse monitors the daily weight of an infant with heart failure. Which finding alerts the nurse to suspect fluid accumulation and thus the need to notify the charge nurse? 1. Bradypnea. 2. Diaphoresis. 3. Decreased blood pressure. 4. A weight gain of 1 pound in 1 day. The correct answer is 4. A weight gain of 1 pound in 1 day. A weight gain of 0.5 kilogram or 1 pound in 1 day is a result of the accumulation of fluid. The nurse should monitor the urine output, monitor for evidence of facial or peripheral edema, check the lung sounds, and report the weight gain. Tachypnea and an increased blood pressure would occur with fluid accumulation. Diaphoresis is a sign of HF, but it is not specific to fluid accumulation, and it usually occurs with exertional activities. The nurse provides home care instructions to the parents of a child with heart failure regarding the procedure for the administration of digoxin. Which statement by a parent indicates the need for further teaching? 1. I will not mix the medication with food. 2. If more than 1 dose is missed, I will call the healthcare provider. 3. I will take my child's pulse before administering the medication. 4. If my child vomits after medication administration, I will repeat the dose. The correct answer is 4. If my child vomits after medication administration, I will repeat the dose. The parents need to be instructed that if the child vomits after the digoxin is administered, they are not to repeat the dose. Options 1, 2, and 3 are accurate instructions regarding the administration of this medication. Additionally, the parents should be instructed that if a dose is missed and it is not noticed until 4 hours later, the dose should not be administered. A healthcare provider has prescribed oxygen as needed for a 10-month-old infant with heart failure. In which situation should the nurse administer the oxygen to the child? 1. When the child is sleeping. 2. When changing the child's diapers. 3. When the mother is holding the child. 4. When drawing blood for electrolyte levels. The correct answer is 4. When drawing blood for electrolyte levels. Oxygen administration may be prescribed for the infant with HF for stressful periods, especially during bouts of crying or invasive procedures. Drawing blood is an invasive procedure that would likely cause the child to cry. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is preparing to administer digoxin to an infant with heart failure. Before administering the medication, the nurse double-checks the dose, counts the apical heart rate for 1 full minute, and obtains a rate of 88 beats per minute. Based on this finding, which is the appropriate nursing action? 1. Withhold the medication. 2. Administer the medication. 3. Double-check the apical heart rate and administer the medication. 4. Check the blood pressure and respiration and administer the medication. The correct answer is 1. Withhold the medication. Digoxin is effective within a narrow therapeutic range. Safety in dosing is achieved by double-checking the dose and counting the apical heart rate for 1 full minute. If the heart rate is less than 100 beats per minute in an infant, the nurse should withhold the dose and notify the healthcare provider. The remaining options are incorrect actions. The nurse is assigned to care for an infant with a diagnosis of tricuspid atresia. The nurse plans care, knowing which is true regarding this diagnosis. 1. A single vessel overrides both ventricles. 2. Frequent episodes of hypercyanotic spells occur. 3. There is no communication from the right atrium to the right ventricle. 4. There is no communication from the systemic and pulmonary circulations. The correct answer is 3. There is no communication from the right atrium to the right ventricle. In tricuspid atresia, there is no communication from the right atrium to the right ventricle. Option 1 describes truncus arteriosus. Option 4 describes transposition of the great arteries. In Option 2, frequent episodes of hypercyanotic spells occur in tetralogy of Fallot. Prostaglandin E1 is prescribed for a child with transposition of the great arteries. The mother of the child asks the nurse why the child needs the medication. The nurse correctly responds that which is the purpose of this medication. 1. Maintains an adequate hormone level. 2. Prevents hypercyanotic spells. 3. Maintains the position of the great arteries. 4. Provides adequate oxygen saturation and maintains cardiac output. The correct answer is 4. Provides adequate oxygen saturation and maintains cardiac output. A child with transposition of the great arteries may receive prostaglandin E1 temporarily to increase blood mixing if systemic and pulmonary mixing are inadequate to maintain adequate cardiac output. Options 1, 2, and 3 are incorrect. In addition, hypercyanotic spells occur in tetralogy of Fallot. The nurse is caring for a child with a suspected diagnosis of rheumatic fever. The nurse reviews the laboratory results. Which laboratory study should assist in confirming the diagnosis of rheumatic fever? 1. Immunoglobulin. 2. Red blood cell count. 3. Antistreptolysin O titer. 4. White blood cell count. The correct answer is 3. Antistreptolysin O titer. A diagnosis of rheumatic fever is confirmed by the presence of 2 major manifestations, or 1 major and 2 minor manifestations from the Jones criteria. In addition, evidence of a recent streptococcal infection is confirmed by a positive antistreptolysin O titer streptozyme or an anti-DNase B assay. Options 1, 2, and 4 will not assist in confirming the diagnosis of rheumatic fever. The nurse is caring for a child with a diagnosis of Kawasaki disease. The mother of the child asks the nurse about the disorder. Which statement most accurately describes Kawasaki disease? 1. It is an acquired cell-mediated immunodeficiency disorder. 2. It is a chronic multisystem autoimmune disease characterized by the inflammation of connective tissue. 3. It is also called mucocutaneous lymph node syndrome and is a febrile generalized vasculitis of unknown cause. 4. It is an inflammatory autoimmune disease that affects the connective tissue of the heart, joints, and subcutaneous tissues. The correct answer is 3. It is also called mucocutaneous lymph node syndrome and is a febrile generalized vasculitis of unknown cause. Kawasaki disease, also called mucocutaneous lymph node syndrome, is a febrile generalized vasculitis of unknown etiology. Option 1 describes human immunodeficiency virus infection. Option 2 describes systemic lupus erythematosus. Option 4 describes rheumatic fever. An infant with heart failure is receiving diuretic therapy, and the nurse is closely monitoring the intake and output. Which is the best method for the nurse to use to monitor the urine output? 1. Weighing the diapers. 2. Inserting a Foley catheter. 3. Comparing intake with output. 4. Measuring the amount of water added to formula. The correct answer is 1. Weighing the diapers. The best method to monitor urine output in an infant on diuretic therapy is to weigh the diapers. The weight of dry diapers is subtracted from the weight of wet diapers to determine the amount of urine excreted. 1 gram is equivalent to 1 milliliter of urine. Comparing intake with output would not provide an accurate measure of urine output. Measuring the amount of water added to formula is unrelated to the amount of output. Although Foley catheter drainage is most accurate in determining output, it is not the best method and places the infant at risk for infection. When a nurse is administering a medication to a confused patient, the patient says, "This pill looks different from the one I had before." Which should the nurse do? 1. Ask what the other pill looked like. 2. Explain the purpose of the medication. 3. Check the original medication prescription. 4. Encourage the patient to take the medication. The correct answer is 3. Check the original medication prescription. Option 3 is the safest intervention because it goes to the original source of the prescription. Option 2 ignores the patient's concern. Option 1 is unsafe because the patient is confused and the information obtained may be inaccurate. Option 4 ignores the patient's statement and is unsafe without first obtaining additional information. A nurse administers an incorrect dose of medication to a patient. Which is the primary purpose of documenting this event in an incident report? 1. Record the event for future litigation. 2. Provide a basis for designing new policies. 3. Prevent similar situations from happening again. 4. Ensure accountability for the cause of the accident. The correct answer is 3. Prevent similar situations from happening again. Risk management committees use statistical data about accidents and incidents to identify patterns of risk and prevent future accidents and incidents. Providing a basis for designing new policies is not the primary reason for incident reports. Although documentation of an incident may be used in a court of law, it is not the primary reason for an incident report. Although nurses are always accountable for their actions, accountability for the cause of an incident is the role of the courts. When preparing to administer a medication, the nurse identifies that the dose is larger than the standard dose recommended by the manufacturer. Which should the nurse do? 1. Inform the supervisor. 2. Give the drug as prescribed. 3. Give the average dose of the medication. 4. Discuss the prescription with the primary healthcare provider. The correct answer is 4. Discuss the prescription with the primary healthcare provider. Nurses have a professional responsibility to know or investigate the standard dose for medications being administered. Nurses are also responsible for their own actions, regardless of whether there is a written prescription. The nurse has a responsibility to question and/or refuse to administer a prescription that appears unreasonable. Giving the drug as prescribed may be unsafe for the patient and may result in malpractice. Changing a medication prescription is not within the scope of nursing practice. The client experienced an electrical burn that resulted in full thickness burns to the right and left hand. The HCP ordered the fluid resuscitation rates. Which data indicates the fluid resuscitation is effective? 1. The client's urine output is less than 30 milliliter per hour. 2. The client's urine output is at least 50 milliliter per hour. 3. The client's urine output is 75 to 100 milliliter per hour. 4. The client's urine output is greater than 200 milliliter per hour. The correct answer is 3. The client's urine output is 75 to 100 milliliter per hour. The client diagnosed with an electrical burn should have a urine output of 75 to 100 milliliter per hour for the fluid resuscitation to be effective. An output of greater than 100 milliliter per hour would indicate the client is losing too much fluid and that the fluid resuscitation is not effective. Urine output of less than 30 milliliter per hour would not indicate the fluid resuscitation is effective. For option 2, this would indicate effective fluid resuscitation for a client diagnosed with a thermal burn, but not for a client diagnosed with an electrical burn. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The charge nurse and the licensed practical nurse are caring for clients on an oncology floor. Which client should not be assigned to the LPN? 1. The client newly diagnosed with chronic lymphocytic leukemia. 2. The client who is 4 hours post-procedure bone marrow biopsy. 3. The client who received 2 units of PRBCs on the previous shift. 4. The client who is receiving multiple intravenous piggyback medications. The correct answer is 1. The client newly diagnosed with chronic lymphocytic leukemia. The newly diagnosed client will need to be taught about the disease and about treatment options. The charge nurse cannot delegate teaching to an LPN. For option 2, this client is post-procedure and could be cared for by the LPN. For option 3, this client has already received the blood products. This client requires routine monitoring, which the LPN could perform. For option 4, the LPN can administer antibiotic medications. The nurse is completing a care plan for a client diagnosed with leukemia. Which independent problem should be addressed? 1. Infection. 2. Anemia. 3. Nutrition. 4. Grieving. The correct answer is 4. Grieving. Grieving is an independent problem, and the nurse can assess and treat this problem with or without collaboration. Treating infections, which require HCP orders for cultures and antibiotics, is a collaborative problem. The treatment of anemia is a collaborative problem. The provision of adequate nutrition requires collaboration between the nurse, HCP, and dietitian. The stem of the question asks for an independent intervention. If you understand the problem and the treatment needs, options 1, 2, and 3 can be eliminated. The nurse is caring for a client diagnosed with acute myeloid leukemia. Which assessment data warrant immediate intervention? 1. Temperature 99.0 degrees Fahrenheit, pulse 102, respirations 22, and blood pressure 132/68. 2. Hyperplasia of the gums. 3. Weakness and fatigue. 4. Pain in the left upper quadrant. The correct answer is 4. Pain in the left upper quadrant. Pain is expected, but it is a priority, and pain control measures should be implemented. The vital signs in option 1 are not alarming. The vital signs are slightly elevated and indicate monitoring at intervals, but they do not indicate an immediate need. Hyperplasia of the gums is a symptom of myeloid leukemia, but it is not an emergency. Weakness and fatigue are symptoms of the disease and are expected. If all the answer options contain expected events, you must decide which is priority, and pain is a priority need. The client diagnosed with non-Hodgkin's lymphoma is scheduled for a lymphangiogram. Which information should the nurse teach? 1. The scan will identify any malignancy in the vascular system. 2. Radiopaque dye will be injected between the toes. 3. The test will be done similar to a cardiac angiogram. 4. The test will be completed in about 5 minutes. The correct answer is 2. Radiopaque dye will be injected between the toes. Dye is injected between the toes of both feet, and then scans are performed in a few hours, at 24 hours, and then possibly once a day for several days. In option 1, the scan detects abnormalities in the lymphatic system, not the vascular system. Cardiac angiograms are performed through the femoral or brachial arteries and are completed in one session. The test takes 30 minutes to 1 hour and then is repeated at intervals. Options 1 and 3 could be eliminated because of the words vascular and cardiac. These words pertain to the cardiovascular system, not the lymphatic system. The client asks the nurse, "They say I have cancer. How can they tell if I have Hodgkin's disease from a biopsy?" The nurse's answer is based on which scientific rationale? 1. Biopsies are nuclear medicine scans that can detect cancer. 2. A biopsy is a laboratory test that detects cancer cells. 3. It determines which kind of cancer the client has. 4. The HCP takes a small piece out of the tumor and looks at the cells. The correct answer is 4. The HCP takes a small piece out of the tumor and looks at the cells. A biopsy is the removal of cells from a mass and examination of the tissue under a microscope to determine if the cells are cancerous. Reed-Sternberg cells are diagnostic for Hodgkin's disease. If these cells are not found in the biopsy, the HCP can rebiopsy to make sure the specimen provided the needed sample, or, depending on involvement of the tissue, diagnose a non-Hodgkin's lymphoma. Biopsies are surgical procedures requiring needle aspiration or excision of the area. They are not nuclear medicine scans. The biopsy specimen is sent to the pathology laboratory for the pathologist to determine the type of cell. Laboratory test refers to tests of body fluids performed by a laboratory technician. A biopsy is used to determine if the client has cancer, and if so, what kind. However, this response does not answer the client's question. Option 1 can be eliminated if you know what the word biopsy means. Option 3 does not answer the question and can be eliminated for this reason. The nurse is admitting a client with a diagnosis of rule-out Hodgkin's lymphoma. Which assessment data support this diagnosis? 1. Night sweats and fever without chills. 2. Edematous lymph nodes in the groin. 3. Malaise and complaints of an upset stomach. 4. Pain in the neck area after a fatty meal. The correct answer is 1. Night sweats and fever without chills. Clients with Hodgkin's disease experience drenching diaphoresis, especially at night, fever without chills, and unintentional weight loss. Early-stage disease is indicated by a painless enlargement of a lymph node on one side of the neck. Pruritus is also a common symptom. Malaise and stomach complaints are not associated with Hodgkin's disease. Pain in the neck area at the site of the cancer occurs in some clients after the ingestion of alcohol. The cause for this is unknown. The client is diagnosed with low back pain and is prescribed cyclobenzaprine. Which instructions should the clinic nurse teach the client? Select all that apply. 1. Take the medication just before leaving home for work each day. 2. Drink a full glass of water with each dose of medication. 3. The medication can cause drowsiness that will make driving unsafe. 4. Divide the dose of medication between early morning and bedtime. 5. Suck on hard candy if you experience a dry mouth. The correct answers are 3. The medication can cause drowsiness that will make driving unsafe, and 5. Suck on hard candy if you experience a dry mouth. Cyclobenzaprine is a muscle relaxant. The medication acts on the central nervous system and can cause drowsiness. The client should be warned not to drive until the client understands the effects on his or her body. Driving could be dangerous for the client and others. Taking the medication before leaving the house could be a danger to the client and others because this medication can cause drowsiness. The client should not be driving or operating equipment until the client has determined the effect of the medication on his or her body. There is no need to drink a full glass of water when taking cyclobenzaprine. A side effect of cyclobenzaprine is a dry mouth, so using hard candy is an appropriate intervention. The charge nurse on an orthopedic unit is transcribing orders for a client diagnosed with back pain. Which HCP order should the charge nurse question? 1. Physical therapy for hot packs and massage. 2. Complete blood count and complete metabolic panel. 3. Hydrocodone PRN. 4. Carisoprodol POBID. The correct answer is 3. Hydrocodone PRN. Hydrocodone is an opioid analgesic. This medication order is incomplete. The nurse should contact the HCP for a time limitation. Physical therapy for heat and massage is standard therapy for back pain. There is no reason to question this order. For option 2, Many medications can affect the kidneys or the liver and the blood counts. Baseline data should be obtained. There is no reason to question this order. Carisoprodol is a muscle relaxant and comes in one strength, so this order is complete. There is no reason to question this order. The nurse is administering medications to clients on an orthopedic unit. Which medication should the nurse question? 1. Ibuprofen to a client diagnosed with back pain and a history of ulcers. 2. Morphine to a client diagnosed with back pain rated as 6. 3. Methocarbamol to a client diagnosed with chronic back pain. 4. Acetaminophen with codeine 3 to a client diagnosed with mild back pain. The correct answer is 1. Ibuprofen to a client diagnosed with back pain and a history of ulcers. Ibuprofen is an NSAID. NSAIDs decrease prostaglandin production in the stomach, increasing the client's risk of developing ulcers. This client has a known risk of peptic ulcer disease. The nurse should question the medication and discuss this with the HCP. Morphine sulfate is an opioid analgesic. Opioid analgesics are administered for pain. The client is in the moderate to severe pain range. The nurse would administer this medication. Methocarbamol is a muscle relaxant. Muscle relaxant medications are administered to clients with back pain to relax the muscles and decrease the pain. The nurse would administer this medication. Acetaminophen is a non-narcotic analgesic, and when combined with codeine, a narcotic analgesic, the potency of medication for pain relief is increased. The nurse would administer this medication. The client diagnosed with low back pain is prescribed morphine sulfate. Which interventions should the nurse implement? Select all that apply. 1. Discuss with the HCP starting the client on a stool softener. 2. Teach the client about rating the pain on a numeric pain scale. 3. Inform the client to rise quickly from a supine position. 4. Administer anticonvulsant medications around the clock. 5. Tell the client to call for assistance when getting out of bed. The correct answers are 1. Discuss with the HCP, starting the client on a stool softener. 2. Teach the client about rating the pain on a numeric pain scale. And 5. Tell the client to call for assistance when getting out of bed. Narcotic pain medications slow peristalsis in the small and large intestines, increasing the risk for constipation and fecal impaction. The nurse should discuss a bowel regimen with the HCP. The nurse should attempt to have the client quantify the pain so that the effectiveness of interventions can be evaluated. The numeric pain scale is one method of objectifying the pain. Rising quickly from a flat on the back position could increase the client's pain. Some of the medications administered for back pain can cause orthostatic hypotension. The nurse should teach the client to turn on the side and push up on the elbow slowly when getting out of bed. The client may be taking antispasmodic and pain medications, but there is no reason for anticonvulsant medications. For option 5, tell the client to call for assistance when getting out of bed. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The client diagnosed with low back pain is scheduled to have a steroid injection into the intrathecal space. Which statement by the client indicates the client understands the procedure? 1. I will have to curl up like a Halloween cat. 2. This procedure will cure my back pain. 3. I will have an injection in each of my hips. 4. There is no risk with this procedure. The correct answer is 1. I will have to curl up like a Halloween cat. Intrathecal indicates into the central nervous system via a lumbar puncture. The client will be positioned with the back arched, much like a Halloween cat, for the HCP to be able to insert the needle between the vertebrae. The procedure provides temporary relief of inflammation of affected nerves. The injections are into the intravertebral space, not into the hips. An injection in the hips indicates an intramuscular injection. There is risk with any procedure. In this procedure, nerve damage is the greatest risk. The nurse is completing the preoperative checklist for a client diagnosed with a herniated disc. Which information is a priority for the nurse to notify the operating room staff? 1. The client is reporting a headache. 2. The client is allergic to iodine and aspirin. 3. The client has not had anything to drink. 4. The client's hematocrit is 43%. The correct answer is 2. The client is allergic to iodine and aspirin. The standard surgical scrub is a povidone iodine antiseptic skin preparation. This should be brought to the attention of the surgical nurse who will be preparing the surgical site so that a substitute can be used. The client's report of a headache occurs frequently when clients have not been able to eat or drink, especially caffeine drinks. This is not a priority at this time. Clients going to surgery should be NPO for several hours to prevent aspiration during anesthesia. Option 4 is a normal hematocrit level. The client presents to the outpatient clinic reporting back pain. Which assessment question should the nurse ask first? 1. What activity did you do to hurt your back? 2. Which over-the-counter medications have you taken? 3. Have you used illegal drugs to treat the back pain? 4. Did you miss any work time because of this pain? The correct answer is 2. Which over-the-counter medications have you taken? The priority at this time is to determine what medications have been tried in order to assess the full extent of the injury. This is the first intervention. Adult clients will frequently only seek the HCP's advice and treatment when remedies have failed. Option 1 is important, but it is not a priority during the initial assessment. The nurse should determine how the client has been treating the injury. This would be the second query, not the first. Option 3 is an accusatory statement and most likely will make the client mistrust the nurse's objectives. This should not be asked at this time. Option 4 is the third query the nurse could ask. Missed work time is important, but to treat the client, the HCP must be aware of the attempted treatments. The client diagnosed with chronic low back pain has been taking baclofen. Which instruction should the nurse review with the client? 1. The medication can cause gastric ulcer formation. 2. The client may consume no more than 1 glass of wine per day. 3. The medication must be tapered off when discontinued. 4. The client should not take the medication before bedtime. The correct answer is 3. The medication must be tapered off when discontinued. Baclofen must be tapered off when being discontinued. Abrupt withdrawal after prolonged use can cause anxiety, agitated behavior, hallucinations, severe tachycardia, acute spasticity, and seizures. This medication is not known to increase the risk of ulcers. The client should be warned not to consume any alcohol while taking baclofen. Baclofen is a central nervous system depressant, as is alcohol. The combination of alcohol and baclofen could intensify the depressant effects. The medication can cause drowsiness, which might assist the client to rest. Administration at bedtime is preferred if this is the case. The nurse is administering 9 o'clock medications to clients on a medical unit. Which medication should be administered first? 1. Morphine sulfate extended release to a client with low back pain. 2. Chlorzoxazone to a client on bed rest. 3. Acetaminophen to a client with a headache. 4. Diazepam to a client with muscle spasms. The correct answer is 4. Diazepam to a client with muscle spasms. Diazepam is a benzodiazepine. A client having muscle spasms is a priority for the nurse. Muscle spasms can be extremely painful. This medication should be administered first. Morphine sulfate extended release is an opioid analgesic and is a sustained-release tablet. This medication is to provide relief of chronic pain over the course of the day. It does not need to be the first medication administered. Chlorzoxazone is a muscle relaxant. The client prescribed bed rest usually takes a muscle relaxant as a routine medication. It does not need to be administered first. Acetaminophen is an analgesic. A headache that is to be treated with acetaminophen would not be the first medication for the nurse to administer. The client is admitted with severe low back pain and prescribed methocarbamol IV piggyback every 8 hours. Which nursing intervention has priority when administering this medication? 1. Ask the client to lie flat for 15 minutes following the IV infusion. 2. Infuse at a rapid rate of 200 to 250 milliliter per hour via an infusion pump. 3. Assess the IV site for extravasation after the infusion is complete. 4. Monitor liver function laboratory tests daily. The correct answer is 1. Ask the client to lie flat for 15 minutes following the IV infusion. Methocarbamol is a muscle relaxant. The client should be kept recumbent during and for at least 15 minutes following the administration of methocarbamol IV to reduce the risk of orthostatic hypotension. The medication must be administered slowly at a rate of no greater than 300 milligrams per minute, not by rapid infusion. The IV site should be assessed prior to the initiation of the medication to prevent complications from extravasation of the medication into the tissues. Methocarbamol is detoxified by the kidneys, not the liver. The client diagnosed with osteoarthritis is prescribed celecoxib. Which statement by the client warrants intervention by the nurse? 1. I take aspirin daily to help prevent heart disease. 2. I am allergic to penicillin and aminoglycosides. 3. I know I am overweight and need to lose 50 pounds. 4. I walk 30 minutes at least 3 times a week. The correct answer is 1. I take aspirin daily to help prevent heart disease. Celecoxib is an NSAID. The client should not take aspirin with an NSAID because it can increase the risk of gastrointestinal upset and possible gastrointestinal bleeding. Allergies to antibiotics are not a contraindication to the use of NSAID. Obesity is not contraindicated in clients taking NSAIDs. Exercising is recommended for clients with osteoarthritis unless it causes pain. Therefore, this activity would not warrant the client not taking celecoxib. The client diagnosed with severe osteoarthritis of the left knee is receiving sodium hyaluronate injected directly into the left knee. Which information should be discussed with the client? 1. Explain that this medication will cause some bleeding into the joint. 2. Instruct the client to avoid any strenuous activity for 48 hours after injection. 3. Discuss that the medication will be injected daily for 7 days. 4. Tell the client that strict bed rest is required for 24 hours after the injection. The correct answer is 2. Instruct the client to avoid any strenuous activity for 48 hours after injection. Sodium hyaluronate is a synovial joint lubricant used for relief of osteoarthritis pain unrelieved by NSAIDs. After the injection, the client can walk and perform routine daily activities, but running, bicycling, or strenuous activities should be avoided. Sodium hyaluronate is a preparation of a chemical normally found in high amounts in the synovial fluid. The injection replaces or supplements the body's natural hyaluronic acid that deteriorates as a result of the inflammation of osteoarthritis. Any bleeding into the joint is a complication. Bleeding into a joint would not be the expected benefit of any type of medication. The treatment includes 3 to 5 injections, with the client receiving 1 injection every week. This injection is done in an HCP's office. The client will be able to walk out of the clinic after the injection. The nurse is preparing to administer the following medications. Which medication should the nurse question administering? 1. Ibuprofen to a client receiving furosemide. 2. Nabumetone to a client receiving digoxin. 3. Acetyl-salicylic acid to a client receiving warfarin. 4. Ketorolac intramuscularly to a client on morphine. The correct answer is 3. Acetyl-salicylic acid to a client receiving warfarin. Acetyl-salicylic acid is a mild analgesic, but it is also an antiplatelet. Acetyl-salicylic acid displaces warfarin from protein-binding sites and will increase the client's bleeding. Therefore, the nurse should question administering the acetyl-salicylic acid. Ibuprofen is an NSAID. NSAIDs do not interfere with the effectiveness of loop diuretics. Therefore, the nurse would not question administering the ibuprofen. Nabumetone is a cyclooxygenase 2 inhibitor. Cyclooxygenase 2 inhibitors do not interfere with the effectiveness of cardiac glycosides. Therefore, the nurse would not question administering the nabumetone. Ketorolac is an NSAIDs. Ketorolac is often administered around the clock to a client in pain, along with a narcotic analgesic. Ketorolac decreases the inflammation to help decrease the pain. The client is taking acetylsalicylic acid 4 to 5 times a day for severe osteoarthritic pain. Which teaching interventions should the nurse discuss with the client? Select all that apply. 1. Do not drink any type of alcoholic beverages. 2. Keep the acetylsalicylic acid bottle out of the reach of children. 3. Inform the dentist about taking high doses of acetylsalicylic acid. 4. Maintain a serum salicylate level between 15 and 30 milligrams per deciliter. 5. Explain that ringing in the ears is a common side effect. The correct answers are 1. Do not drink any type of alcoholic beverages. 2. Keep the acetylsalicylic acid bottle out of the reach of children. 3. Inform the dentist about taking high doses of acetylsalicylic acid. And 4. Maintain a serum salicylate level between 15 and 30 milligrams per deciliter. Alcohol displaces warfarin from protein binding sites and will increase the client's bleeding. Therefore, the nurse should instruct the client not to drink alcohol. Acetylsalicylic acid poisoning can kill children, and all medications, prescription or non-prescription, should be kept out of the reach of children. High doses of acetylsalicylic acid can cause bleeding. Therefore, the dentist should be made aware of the client's medication use. Aspirin toxicity can occur when the client is taking acetylsalicylic acid 4 to 5 times a day. Therefore, the serum level should be kept within normal limits. Mild toxicity occurs with serum levels above 30 milligrams per deciliter, and severe toxicity occurs above 50 milligrams per deciliter. Tinnitus is a sign of aspirin toxicity and should be reported to the HCP. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. At 9 o'clock, the charge nurse observes the primary nurse crushing an enteric-coated aspirin in the medication room. Which action should the charge nurse implement? 1. Take no action because this is an acceptable standard of practice. 2. Correct the primary nurse's behavior in the medication room. 3. Explain that enteric-coated medication should not be crushed. 4. Complete an adverse occurrence report on the primary nurse. The correct answer is 3. Explain that enteric-coated medication should not be crushed. The charge nurse should explain to the primary nurse that enteric-coated aspirin should not be crushed because the coating ensures the aspirin will dissolve only in the small intestine where the coating dissolves. The aspirin will be absorbed in the stomach if the coating is crushed. Enteric-coated aspirin should not be crushed. The charge nurse should not correct the primary nurse in front of other staff, and at 9 o'clock, there would be other nurses in the medication room. Because the client did not receive the crushed enteric-coated aspirin, no adverse occurrence report needs to be completed. This form is completed if the client's condition has been compromised in some way. The client diagnosed with a partial thickness burn is prescribed mafenide acetate. Which intervention should the emergency department nurse implement when applying this medication? 1. Do not administer if the serum sodium level is decreased. 2. Assess the client's urine for any increased concentration. 3. Determine the amount of burned skin using the rule of 9. 4. Pre-medicate the client prior to administering the medication. The correct answer is 4. Pre-medicate the client prior to administering the medication. Mafenide acetate is a topical antimicrobial. The medication causes pain or a burning sensation following its application. Therefore, the client should be pre-medicated. The serum sodium level is not affected by mafenide acetate, a topical antimicrobial. It is affected when administering silver nitrate, a topical antimicrobial that is also used to treat burns. Urine concentration may be affected by silver sulfadiazine, a topical antimicrobial that is used to treat burns, but mafenide acetate does not affect urine concentration. This should have been done prior to the emergency department's physician prescribing this medication. Therefore, this would not be an appropriate intervention. The nurse is discussing the application of silver nitrate to a client diagnosed with a partial thickness burn to the left leg. Which information should the nurse teach the client when discussing how to apply this medication after discharge? 1. Administer the silver nitrate ointment directly to the burned area twice a day. 2. Notify the HCP if a black discoloration occurs on the burned area. 3. Apply the silver nitrate solution to the wound dressing every 2 hours. 4. Do not allow anyone except the HCP to change the wound dressing. The correct answer is 3. Apply the silver nitrate solution to the wound dressing every 2 hours. Silver nitrate is a topical antimicrobial. Silver nitrate is used as a 0.5% solution in distilled water and should be applied to the bulky gauze dressing every 2 hours, and the dressing should be changed twice a day. Option 1 is the incorrect way to apply silver nitrate. Silver nitrate solution causes a black discoloration on all skin surfaces and dressings with which it comes into contact. Therefore, the client would not need to notify the HCP. The bulky wound dressing must be changed twice a day. Therefore, the nurse must teach the client to change the dressing. A dressing change does not have to be done only by the HCP. The client diagnosed with a full thickness burn over 38% of the body is admitted to the burn unit 4 hours after the fire. The HCP writes an order for Ringer's lactate 450 milliliter per hour. Which interventions should the nurse implement? Select all that apply. 1. Question the HCP's orders. 2. Administer the IV fluid as prescribed. 3. Infuse the IV fluid via a pump. 4. Do not administer more than 200 milliliter an hour. 5. Verify the order with another nurse in the burn unit. The correct answers are 2. Administer the IV fluid as prescribed, and 3. Infuse the IV fluid via a pump. There are formulas that are used to determine the client's fluid volume resuscitation. The formulas specify the total amount of fluid that must be infused in 24 hours, 50% in the first 8 hours, followed by the other 50% over the next 16 hours. This is a large amount of fluid, but its administration is not uncommon in clients diagnosed with full thickness, burns over more than 20% of their total body surface. The IV fluids must be infused on a pump to ensure the client receives the correct amount for fluid resuscitation. For option 1, the nurse should administer this IV fluid as ordered. For option 4, this is not an unusual amount of fluid to be infused. There is no absolute amount of fluid that a client may require during fluid resuscitation. For option 5, there is no reason to verify this order with another nurse in the burn unit.
A client with depression who is taking doxepin sinequin, 100 milligrams PO, at bedtime has dizziness on arising. Which of the following suggestions is most appropriate? 1. Try taking a hot shower. 2. Get up slowly and dangle your feet before standing. 3. Stay in bed until you are feeling better. 4. You need to limit the fluids you drink. The correct answer is 2. Get up slowly and dangle your feet before standing. Rationale. Doxepin and other tricyclic antidepressants may cause postural hypotension, especially in the morning. Postural hypotension occurs because the tricyclic antidepressant inhibits the body's natural vasoconstrictive reaction when a person stands. The nurse regularly monitors the client's vital signs, both lying and standing. The nurse should instruct the client to rise slowly and dangle his feet before standing. Advising the client to take a hot shower is detrimental to the client's safety. Heat causes vasodilation, which could further exacerbate the dizziness, placing the client at risk for falls and subsequent injury. Telling the client to stay in bed until he is feeling better is not helpful and is impractical. The client with depression would rather stay in bed and withdraw from others. Placing the client on fluid restriction is detrimental to the client with depression whose fluid and food intake may be inadequate.
You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguide.com.